On Tuesday, during her regular COVID-19 briefing, New York Governor Kathy Hochul reiterated the plan she announced a month ago to spend billions of taxpayer dollars to not only stop the massive loss of healthcare workers in the state, but to increase the workforce by 20%.
We have to stop the hemorrhaging of current healthcare workers. They're still leaving. And how we do that, we say, we're not just going to say we owe you a debt of gratitude, as nice as that sounds. We also have to pay you the debt we owe. And we are investing over $4 billion in bonuses and wages for our healthcare workers.
Now, you might recall this is the same governor who just a few months ago was adamant that every healthcare worker in New York, this was before the federal mandate, that they had to have the vaccine, and she said there will be no religious exemptions for any healthcare worker. Now, we look at the numbers, and it's very difficult to track the numbers because it's not being reported, but you can see in the state of New York where anywhere from 5% to 15% of some of these institutions have lost healthcare workers because of the mandate. And again, some just retired, some left, some quit, some have moved on. And so there is now a crisis, and this is not just New York, it's happening all across the country. But are we revisiting one of the, what I would point to as one of the significant catalysts for this crisis, and that is this mandate? Many healthcare workers, as we've talked about, have already had COVID, so they have natural immunity. And we've seen that the vaccines don't even work. I mean, yes, I understand we are told, but I'm not sure I believe anything I'm told anymore with the lies that we're being told by those in charge. But we're told it minimizes the effect. I've not been vaccinated, and I've had both strains, and I've been fine. And I think I didn't have Delta. I take that back. I had the Omicron in the first one. But the reality is public policy is driving this crisis. So now, instead of revisiting it and saying, maybe we did this wrong, maybe we shouldn't do it, maybe we should get past this, allow people to come back to work, they're now looking to go overseas to find healthcare workers. This is insane. With me now to talk about this is Matt Staver, founder and chairman of Liberty Counsel, who has argued in court on behalf of healthcare workers with religious objections to the vaccine mandates, in particular in the state of New York. Matt, welcome back to Washington Watch.
Thank you, Tony. It's good to be with you.
First, let me get your thoughts. Maybe it's just me, but I think the governor is just, it's beyond bizarre that you would go out there offering all of this money after you just drove healthcare workers out of the business because you mandated that they get this vaccine, even if they had a religious exemption or a religious concern about it.
That's right. Two states started off about the same time, and then the third one joined in. The first one was Maine, and the second one was New York, about the same time. And then Connecticut joined in as well before these federal mandates. And New York, for example, just like Maine, they said that all the healthcare workers coming from these governors, Hochul and then Mills in Maine, had to get the COVID vaccine by a certain date. And if they didn't, they should be fired. They went even further than that, Tony, and they said you cannot, as an employer, give them religious accommodations to their sincerely held religious beliefs. In other words, you cannot abide by the federal Title VII law, which preempts anything else. You must ignore that. But if you do violate the governor's order and recognize a religious exemption and do not fire these individuals, then you will lose your business licenses. So these employers had essentially no choice but to follow the governor's order, even though they didn't want to. Now, in Maine and New York, you already had a shortage of healthcare workers in 2019 before we had COVID.
Right.
So when COVID hit in 2020, these people, many of them continued to go back to work. And some of them got out of the healthcare industry. They didn't know what they were doing. Some of them had elderly parents at home. They didn't know what they were bringing home. Most of them stayed. But we developed this concept of traveling nurses because of different outbreaks of COVID around the country. And so nurses would travel from place to place around the country. to fill in those gaps because we had a shortage that predated COVID and was a little bit exacerbated by COVID. Then on top of that, you have this incredibly stupid order by Governor Hochul in New York and Mills in Maine to mandate all of them get the vaccine by a certain date and prohibiting employers from granting the religious exemptions. Early on at that time, they said that they would do one of two things to fill the gap. This was before they started the mass exodus because they didn't want to get the COVID shot. As many of them, as you said, they already had COVID and they developed natural immunity. And they didn't want, for various reasons and other religious reasons, they didn't want to get the COVID shots. So before the exodus happened, right after these governors issued the mandates, they said, well, we're going to call in the National Guard. And they made that commitment before the first healthcare worker had to leave because of this mandate. And they said, we'll start hiring foreign workers. These foreign workers are not trained in our system. And the National Guard is like putting your finger in a bathtub to try to raise the water level, because the number of workers that have left New York and Maine, as an example, are in the thousands. And the National Guard just simply doesn't have that kind of nurses or doctors to be able to come in to replace that loss. So who suffers? It's the patient. In fact, Tony, in a different state where they didn't have the same kind of mandate, but they had mandates in the state of Washington, I know someone whose wife was taken to the emergency room because she was having contractions 3 minutes apart. You would think that that would be an emergency. But when she presented at the emergency room, she was told to go home because they're only treating, quote, emergencies. They are understaffed, and to come back when your water breaks or you develop abnormal bleeding. She and her husband had to return home until she was in excruciating pain, and one of those two events happened, and then they had to rush her right back to the hospital because they were short of staff. Yeah. Short of staff because of these mandates.
Right, and people need to realize that when you have a shortage of nurses, that means you have a shortage of beds, because the number of beds are tied to the number of nurses. Matt,
exactly.
we're out of time, Matt, but just bizarre, the public policy that we're pursuing, and then refusing to recognize the consequences of these decisions. Always great to talk with you. Thanks so much for being with us.
Well, thank you, Tony. They've created their own mass crisis.